Hi, my name is Emily Batterman. I am a born and raised Floridian residing right here in Melbourne, Florida. A little bit about myself is that I am a mother of 3 children, so it's really rare for me to get time to myself. When I'm not at school or studying, I find myself at the baseball fields with my kids or getting out of my comfort zone with baking. I enjoy challenging myself with complicated and decorative designs on sweet treats. I bake for all family birthdays, holidays, and gatherings, so if you name it, I can bake it. I've recently spent some time volunteering with the Health First Mother Baby Suite, which was extremely rewarding in being able to help new parents navigate their sweet new journeys. Ever since I was 15, I knew that healthcare was where I was meant to be. Having previously worked in pharmacies, local doctor's offices, and hospitals, I just wasn't exactly sure where my place was. It wasn't until back in 2015 when I had my first child that was born with breathing complications is when I first came in contact with a respiratory therapist. The way they swiftly handled my fragile baby with so much care was truly inspiring. But before having this experience, I truly had no idea what a respiratory therapist was. When someone was coding or needed help with their breathing, I thought it was a nurse or physician to come into the room. So it was even more inspiring to have that realization that respiratory therapists make a significant impact in patients' lives by directly helping them breathe, furthermore improving their quality of life. Once I attended an open house here at Eastern Florida for the respiratory care program, I absolutely fell in love. Between simulation stations and talking to active students in the program, I knew that I finally found where I was meant to be. Becoming a respiratory therapist is the career for me because I am deeply committed to making a substantial difference in people's lives, especially when it comes to something as fundamental as breathing. Patient advocacy and safety are my number one priority. As they come in for respiratory complications, patients are trusting you to treat them with compassion and care. The idea of assessing complex patient conditions while operating advanced medical equipment like ventilators genuinely excites me. I am not afraid of a challenge, and the continuous learning to stay current with new technologies and treatments in the respiratory care field aligns perfectly with my love for expanding my knowledge and my skills. My 3 biggest attributes that I would bring to the respiratory care program is my ability to respectfully collaborate with my peers through teamwork, perseverance through any obstacle and knowing when to ask for help, and critical thinking skills in order to evaluate my patients and treat them properly. When I hear professionalism, I think of always maintaining your composure in front of peers and patients, speaking respectfully, and knowing how to perform well under pressure. I believe it also means being able to accept constructive criticism while also being able to learn from it, knowing when to ask for help, and respecting your patient's autonomy. Once accepted into the respiratory care program, I am most excited about expanding my knowledge. Respiratory therapists play an extremely vital role in our healthcare today, coming a long way in really such a short amount of time. I take a lot of pride in how efficiently and effectively I can work under pressure. Being fast on my feet and quick critical thinking is crucial to the daily duties of a respiratory therapist. It is deeply rewarding to be a part of saving a life, and I want to be a part of that change that I want to see in the world. Continuing education, having varied responsibilities, and being able to work in so many different settings is one of the reasons why I'm so excited to be a part of the respiratory care program. Thank you so much for your consideration in my application to the respiratory program. I am not only grateful for the opportunity, but I'm also incredibly enthusiastic about the chance to make a positive impact on the lives of patients and with respiratory needs. I'm confident that my passion for patient care, combined with the program's excellent training, will enable me to provide exceptional care and support to those who need it most. Thank you so much for your time and consideration again, and I look forward to the opportunity to discuss my application further.